Hello. You're going to be hearing quite a lot from me this month of October on a subject that has become near and dear to my heart. It's referred to as person and family engagement. And as many of you know and have known me for years, engagement has been a very strong point of focus for me. Person and family engagement is about engagement between the individuals who are engaging in a hospital setting specifically, or a healthcare setting of any kind. And it is the engagement specifically between the people, the patients that are being cared for, their family members and those around them who are helping them receive the best care they can, and those who are providing the care, from the direct clinicians and practitioners all the way through to the boardroom. You're going to be seeing a number of tweets and Facebook postings, and you're going to hear me talk about it if we're sitting down for tea together, not just this month, but probably for the rest of my life. And many of you know the story behind why it has become important to me to look to safety in healthcare. But today, I just really want to kind of bridge it with something that's happening in the world today, and that is harm, the question of harm. There is a lot of focus right now on what I will call intentional harm or agenda harm. In other words, intentional harm of people who are very much intending to harm another person, and how prevalent that is and how difficult it is to deal with that. And there are a lot of really good questions about what should be done in the circumstances of so many people intentionally harming others, including the animals and dynamics that are at play on this precious planet. Then there is the what I'll call agenda harm, which is I am seeing a lot of actions toward a particular agenda at the expense of others, knowing that there will be harm and doing so proceeding anyway. One of my dear friends likes the term proceed until apprehended, and I know that he means well by that, and he's done a lot of good with that, I'm sure. But I also think there's a limit to that, and it's important for us to really know what our values are. But when we get so focused on a particular agenda that we begin to put others in jeopardy, it's time to put a pause on it. It's time to navigate one's own nervous system, whether it's showing up as worrisome, anxiety, stress, not being able to breathe, not being able to sleep. There are a number of things that show up when we begin to deviate from our values and our beliefs in the interest of a particular agenda. And I'm going to go out on a line here and say that there probably isn't anyone who's listening right now who hasn't faced that personally, who hasn't been in a situation such as that, and will be again. So I think it's really important for us as a people today, especially given the way that things are going in society and around this globe, to get better at managing ourselves when our agendas begin to interrupt our values and our, what I'll call, our bigger agenda. So I am going to be providing some tools over the next couple of months in the form of an online program to just help people get really clear about what those values are, and to be able to understand when a small micro agenda is interrupting a macro agenda. That's an important thing for people to be able to know how to navigate. Then the third thing, and where it relates to person and family engagement, is that there are a whole lot of people who go into work every day intending to create health and well-being, intending to protect, intending to heal. And instead, harm happens on their watch with their actions. It is not their intent. Sometimes maybe it is about a competing agenda. That could certainly be the case. But for the most part, these individuals are as devastated as the person's being cared for and their family members, like myself and our family were when Yogi Raj went into the hospital in 2012 for one reason, healed from that, and died from a hospital associated circumstance. So it's that zone right there that you'll find me paying particular attention to in the coming months. And I hope that you'll join one of our online programs. We'll be creating a Catharsis Cafe that will help individuals who have experienced harm in healthcare, whether it be as a practitioner or as a person or a family member receiving care, and to bring dialogue and conversation so that catharsis can happen, so that there can be healing from even those experiences. I'm also starting a project called the Ashram Project in January. And that is one of Yogi Raj's signature programs, which brings together his very Western training with his Eastern training into something that really helps individuals identify what's important to them and how do they go about moving forward in such a way that has integrity with themselves and with others. So that's just a little flash about why you'll see so much from me this month. I promise I won't keep doing this forever. I won't keep I won't keep communicating as frequently as I am, especially via email and things like that. I'm very respectful of people's time, but I wanted you to have a sense of why this month is important and what's to come.